SHE SOARS project is a project that targets to support the adolescents, supporting them to enhance and realize their sexual reproductive health and rights, but also economic empowerment.
For many years, adolescents and young people have faced various barriers to accessing reproductive health services and information.
As a youth-led organization in Kenya supporting the SHE SOARS project, our mandate is basically to ensure that young people are brought at the center of decision-making table.
In Uganda, when it comes to access to sexual reproductive health and rights, many young people fail to access, more especially those who are out of school.
Under the SHE SOARS project implemented in Zambia, Kenya, and Uganda, we aim to increase access to sexual reproductive health services and information for adolescents out of school aged between 10 and 19. And for Zambia, what does that look like? This looks like engaging members of parliament in increasing the national budget for health, specifically for reproductive health services such as family planning and antenatal. It goes beyond that. It goes beyond that by engaging the Ministry of Health itself. As a youth-led organization on the SHE SOARS project, we engage directly with the Ministry of Health through the accountability mechanism on family planning and sexual reproductive health, and of course the Ministry of Health Adolescent Health Technical Working Group. But we know that there is no change without meaningful youth engagement and youth-led advocacy. And on the SHE SOARS project, we make sure that we create space for young people to be able to table their lived experiences and their barriers that they're facing in accessing these services.
We are pushing for meaningful youth engagement because we believe that nothing for us without us. And therefore, young people should participate not only for tokenism, but for substantive engagement. We've been able to participate at different levels, from national to regional. And at the national level, we've been able to engage with the Ministry of Education. We've also been able to engage with relevant stakeholders who are working on matters to do with adolescent sexual reproductive health and rights, and in ensuring that there is adolescent and youth responsive SRHR services as well as information. And we are also glad that we've been able to be part of the team that has established the technical working group that is working on the school re-entry and retention guidelines of 2020, because as our advocacy priority states that we are looking forward to ensuring that adolescents who dropped out of school as a result of teenage pregnancy are able to be reintegrated and also retained to schools without any fear of stigma or discrimination.
As a youth-led organization, we have been able to do some of these discussions at the district level, division level, as well as national level, whereby we are engaging different stakeholders and letting them know that access to sexual reproductive health is really very vital for adolescents. When it comes to different policies that we have, there are so many policies, but the implementation has been so weak. For example, when you look at the East African Youth Policy in regards to regional policies, it was not really very implementable, and also the language that was used before in the previous youth policy was not so friendly. So through the consultative meetings we have been part of with the East African Committee, we have been able to influence some of these changes. It also comes to education, because there are some adolescent young mothers who would wish to go back to school. They would want to go back and have formal education, but it is very hard because of some of the issues they have faced within the community. For example, the way schools do pregnancy tests, the mandatory pregnancy tests, some of them are not done in a well-dignified manner, whereby even the dissemination of this information to them is not given to them in a confidential way. So this creates a lot of stigma within the school and also out of school, because those in school go around spreading the information, oh, this son and so was called pregnant, so they are not able to go back to school. Also, the communities do not believe that girls, once they give birth, they can still have an opportunity to go back to school.
Specifically for the Center for Reproductive Rights, we work with the women rights organizations and also the youth-led organizations. So why we work with these organizations under advocacy is that one of the things that we seek to look at and achieve in this project is strengthening the capacities of national partners in advocating for issues to do with legal advocacy, policy advocacy, to improve the lives of adolescents when it comes to access of their reproductive rights. So one of the reasons that we are working with the youth-led organizations is because of their skills. We come to realize that there is nothing for the youth, for the adolescents, without having them engaged. So we looked at that approach of ensuring that we enhance youth accountability in advocating for the rights of adolescents while doing advocacy for their reproductive rights. Engaging the youth-led organizations has not only stopped at subnational or at national level, we have seen them engage even at regional level. Take an example, when the East African community, through the East African Youth Network, was reviewing the East African Youth Policy, we had the youth-led organizations take lead in this process. Yeah, we worked in collaboration with other entities, but we saw that their participation was really eloquent, it was efficient. Number one is in the revision of the policy, they ensured that the language in the policy is captured in a youth-friendly language. So that it is responsive to the evolving needs of the youth. And then also calling upon member states to enhance comprehensive sexuality education and ensuring that the adolescents and the youth are able to access RH commodities. It is something that has been incorporated in this policy at its validation stage. At AU level, we have worked and engaged with the youth-led organizations. We have, as the center, we have given them an opportunity and a platform to engage with the African Committee of Experts on the Rights and Welfare of a Child, and specifically first through engaging with the CSO Forum, where they had a very successful panel on youth accountability, and they were able to share some of the progress of what they feel they have achieved from youth accountability as they hold duty bearers accountable at national level. They called upon member states to engage the adolescents and the youth in state reporting. These are some of the things that came out of the outcome statement. But also another thing they advocated for was youth and adolescent participation at the different levels of advocacy. That the states and civil societies as well, even the ASEREC, should continue to engage with the adolescents and the youth so that they are able to pick out the contextual issues that are affecting adolescents. And we have seen that the ASEREC committee was very excited when they got to this recommendation that there should be adolescent participation that can as well be led by the youth in the different states.